Welcome back to my channel. We are still in this sickle cell series. Today, remember the last lesson I told you how sickle cell can be inherited. That no one parent can produce a child with sickle cell. That the 40 cells, the 40 cell, that is the S, must come from either of the parents. So sickle cell is not something that we can toy with. I want to give you symptoms of sickle cell disease. The symptoms of sickle cell disease. First of all, the number one of it is anemia. Remember, anemia is a situation where you have a shortage of healthy red blood cells or hemoglobin that can transport oxygen around the body. So because of the faulty cell S, the hemoglobin that is in form of S, it is very, very difficult for people with sickle cell disease to produce healthy hemoglobin. And because of that, they're always anemic. And this anemic, the symptoms anemic can be fatigue and weakness, paleness. If you see people with sickle cell, you see that they are pale, shortage of breath, dizziness, and lightheadedness because of low oxygen. They don't have enough healthy hemoglobin to transport oxygen around the body. So, number one symptom is anemia. The second symptom is pain. Oh my God. They have pain crisis at the chest, at the back, at arms, legs. And also they have chronic pain from bone and joint damage. And then painful swelling of hands and feet, particularly in infants. We call it dactylitis. That is painful swelling of hands and legs in infants. Another symptom of sickle cell disease is jaundice, yellowing of the skin and whites of the eye. And this is caused by body breakdown of hemoglobin to build up what is called bilirubin rubin in the which is responsible for the dark yellow color. Jaundice, sickle cell disease sufferer, they have delay in growth and development. They don't develop like their peers. They are almost a kind of smallish. So one symptom is delayed in growth and development, and also increase in infections. They have a lot of infections because of low oxygen, shortage of red blood cells that transport oxygen around the body. They have increased risk of infection. They have what is known as acute chest syndrome. Chest syndrome, which will always result like a sickness, a pneumonia-like illness, and that can cause morbidity. That is causing a lot of sickness, disease, can cause hospitalization. It can cause death. And this what we call the ACS, acute chest syndrome, affects both infants and adults. Another symptom is what is known as that is stroke. Can also result to stroke. Stroke, what usually causes stroke, when oxygen is cut off from the brain, can cause stroke. One of the symptoms also is vision problems. They will have vision problems. And another problem is what is called splenic sequestration. Splenic sequestration. And this splenic sequestration is a situation where sickled red blood cell will go and will be trapped by the spleen. Those sickled red blood cells will be trapped by the spleen. Instead of, and when they are trapped there, they will reduce blood flow, and this continue to get bigger and bigger, and that will result to swelling, the swelling of the spleen, and also painful situation. This usually take place more in infants, maybe infant children from infants to about 5 years. We call it splenic sequestration. The spleen will be enlarged because of that sickled blood cell, we congest there. The spleen will trap it, and all of them will continue to mount, and the time will come when it will become so big that it can also, affect the blood flow in the spleen, and that will always cause a lot of, pain. A lot of pain. The reason why I'm explaining all these things is for us to be able to appreciate the problem with this sickle cell disease. Perhaps that might affect our thinking, so that people that still want to marry, despite the fact they know that there are AS and AS and they want to marry, I want all these symptoms, and I've explained, just for you to appreciate the fact that this thing is not good for our children. So let's avoid it, getting married, AS and AS, or AC and AS. In our next video, I will now tell you triggers. What are the things that can trigger crisis? I don't know whether you have seen somebody with sickle cell crisis. I've seen many. I will tell you what can trigger it, so that if you have somebody who is suffering from sickle cell, or you have a neighbor who is suffering from sickle cell, some of the things that cause trigger, that can trigger the crisis can be reduced, so that they will also reduce the painful episode. Thank you. Stay tuned as I come back. Bye for now.